Hello everyone and welcome to SoftFil Academy's webinar. We are so glad to welcome all of you tonight. Thank you so much for connecting. Thank you so much to our team of experts for being here with us tonight. I am Hannah Tebeka Azriel and I will start introducing this webinar, introducing our speakers and telling a little bit about SoftFil. And then I will let the speakers talk about the heart of the issue tonight, Topilas. I am just, trying to change the slides. All right. So the theme tonight is everything on Topilas, the new topical hyaluronidase. To speak about this, we are welcoming four speakers. First, Dr. Sandrine Sebban, who is an aesthetic doctor from France. Dr. Sebban is the creator of SoftFil. She is also the creator and the inventor of several microcannula injection techniques. And she is the inventor of Topilas. So it is a great honor to hear her insights tonight and understand why she created Topilas and speak about the product. Then Dr. Ambroziak will take the speech. Dr. Marcin Ambroziak is a dermatologist from Poland, and he was part of the international expert study on Topilas. So he knows the product very well, and we are very excited to hear about his results with Topilas and how he uses the product. Then we are welcoming Dr. Jesus Chicon, who is an aesthetic doctor from Spain. He's a dear friend of SoftFil and a SoftFil Academy trainer for many years, so he knows all of SoftFil products so well. It was just very normal for us to invite him tonight, as he has been using Topilas for more than a year. And Dr. Paola Molinari, who is a plastic surgeon from Italy, and she also was part of the international expert study on Topilas. And she has great insights, and she will give all of you amazing advice on how to use Topilas, and she will show us her clinical results using the product. So thank you to all of you.
Thank you. Thank you, Anna.
So a little bit about SoftFil first. SoftFil has been created more than 10 years ago. It is an international brand with products sold in more than 90 countries now. The main mission of SoftFil is to simplify and secure the practice of aesthetic medicine. And for that, to complete that mission, we have created several tools. So of course, as you all know, we created the largest range of microcannulas on the market, the SoftFil Precision range. We have 22 sizes of microcannula for the body and for the face. We also developed a patented pre-hold device, the SoftFil Easy Guide, that eases the insertion of the cannula into the skin and that guides the cannula to the right insertion point. We have 8 sizes for the SoftFil Easy Guide. And lastly, we developed a SoftFil cosmetic range with 6 skincare products, Topilas, of course, but also skin rollers, the post-act mask, a hyaluronic acid-based mask, a massager, and a skin marker. So now I will let Dr. Sebban take the speech. Don't worry, we are recording the webinar, so the replay will be available from tomorrow on SoftFil Academy's website. And please don't hesitate to ask any questions, but all the questions will be answered at the end of the webinar. Thank you.
Thank you very much. Thank you all to being here. Thank you, of course, I will thank my colleagues to be a part of this webinar, and I'm very happy today to speak about this new product, very efficient and very useful in our practice. So why Topilas? Because you know that I use hyaluronic acid, of course, for injections since 22 years at the moment. And you know that I have the experience of filler injection with HA, of course. And I think it was very important for me to invent, to have a new product, because there was a gap in our practice to perfect our result. Usually when we are injecting, you know, now and of course currently we inject in 3D. We used to do volumetry and we inject in different layers. So a lot of course, brand of HA are using different viscosity for each layer when we are injecting in order to restore the aging process. So now we know that when we use to inject, we use different, you know, layers, meaning subcutaneous fat, the superficial fat, the deep fat, and the bone layer. And sometimes there is some mistake or migration into the skin, and there is some irregularities and side effects due to wrong injections. So as you see here, we have different side effects that we can observe. We have the Tyndall effect that we used to see when the injection was too superficial, as you see in the first picture, usually in the periorbital area. And usually it's very hard to remove and very, very, you know, difficult to leave for our patient. You can see the overcorrection, the overfill syndrome that we can see so much time and too much often currently. So this is due to too much injection every year of too much product, or in only one session. Of course, you know that we can have very large inflammation or edema around the lips, and immediately we can have swelling on the lips due to you know, the injection, the introduction of the needle or the cannula into the lips. And we can have granulomas. So you see here, I don't speak about embolism because Topilas is not, you know, effective for that. It's a product created only for improve the result and to be perfect and very artistic when we are injecting our patient. The next slide, you know that now we have only one solution until now. It was the injectable hyaluronidase, and you know that hyaluronidase is enzymes which depolymerize the injected hyaluronic acid. So next slide. So you see that we have, of course, a lot of benefits due to hyaluronidase injectable, but we have a lot of drawbacks. And the benefits are very interesting because it's very efficient, of course. It is, you know, an action very fast. It's very easy to use for injector, and the result is very instant. But we have a lot of drawbacks, and drawbacks are, of course, you know, anaphylactic shock sometimes and very allergic, you know, result. We can have edemas, we can have erythemas, and of course, as we do a very efficient, you know, reduction of hyaluronic acid injected, we can create sagging of the skin, a loss of volume, and a loss of firmness. And of course, everybody saw when we are injecting the hyaluronidase, we can see a diffusion. And sometimes there is, you know, an effect in another area that we are expecting. Usually the hyaluronidase it's animal, so we can have, you know, some side effect due to animal product. And of course, you know that in many countries it's forbidden for, you know, artistic result. It's only allows, sorry, for, you know, the vascular occlusion, but not for removing the irregularities. The next slide. So you know that on the market we have a lot of injectable hyaluronidase. Those hyaluronidase are usually a cosmetic injectable, so it's not, you know, allows really in many countries, but we have only one hyaluronidase allows in Europe and in the world as a medical device. It's the Topilas, as you know, but very hard to find. The next slide. And why I create Topilas, because, you know, I think that sometimes, and I see this kind of problem always in a week, I see a few person, usually who are coming for the first time, and they tell me that they have, you know, irregularity due to another injection, sometimes, you know, swelling under the eye, or you know, ball on the lips. And we see the patient for the first time, and we need to you know, enhance this kind of problem. So we want to remove the problem, of course, and we want to perfect the result, to have a really perfect result in a global concept. So what can we do except, you know, using cosmetic? So I was thinking about that 5 years ago, and slowly I worked with pharmacologists and with the dermatologist, and it was very interesting to invent a new way to perfect our result. And this way is the cosmetic, you know, to use in hyaluronidase in cosmetic. So this is a topical care, non-invasive, with a very interesting skin tolerance, no problem, no secondary effect. At this time, I never saw secondary effect and allergy, and no softening of the tissues. The next slide. So here you see that the valve, and you know that this product is French. The next, what this product contains. So we have 100% of natural origin ingredient. It was very important for me, and there is no conservator. And you have inside two compartments. The first compartment contains a powder. This powder mixes, you know, 3 enzymes: the hyaluronidase, the protease, and the lipase. And why? Because when I used at the beginning the hyaluronidase only, it was not effective, and I needed to improve the effect of you know, the introduction into the skin. So I wanted to go inside, of course. So I have play with 2 effects of the hyaluronidase. The first one is that hyaluronidase, it was proved, is a vector of penetration of different active principles, and hyaluronidase depolymerize hyaluronic acid injected. It doesn't act on own hyaluronic acid, because, as you know, we are, you know, we do hyaluronic acid every day. Our skin tissue is creating hyaluronic acid every day. So this complex is very interesting, because the synergy between all you know, enzymes help to penetrate the skin, but to go with the product contained in the lower compartment. This solution contains essential oils, aloe vera, and, you know, different you know, characteristic in order to have a good disinfection, in order to be a moisturizer, to conserve the firmness of the skin, and to decrease the swelling of injection. So when I use the complex mixed with the solution, I have two actions. I help the enzymes to go inside the skin with the essential oils, but I help the essential oils to go into the skin due to enzymes. The next slide. So you see that, of course, it's a cosmetic because it contains concentration of hyaluronidase just enough to be a cosmetic. And we have, of course, two effects. This penetration into the skin due at the chemical effect, but in the same time, we have to use a mechanical effect by pressure, and with a massage, we can, of course, have a better effect on the HA injected. So two effects. The application is not enough to have an effect. You do an application of product, but you have to do a strong massage in order to destroy, not really destroy, but dissolve the product under the skin. Next slide. So the protocol is very easy. You can see here, of course, everybody knows this kind of action. This is a push and mix technology. So you have inside, compartment when you push in the upper compartment, you can have the distribution of the powder into the solution. You have to mix and to shake very well the valve, and like that you active the product. The next slide show you the protocol in video. So here you see it's very easy. You have to clean the skin of your patient. You can use it immediately after an injection if you see a swelling, for example, on the lips. Here you shake the valve, as you can see on the video, and you take the dispenser tip, you put the dispenser tip into the box, and you apply the cream. The cream is enough viscous in order to not have a migration on the skin. And if you want to have a better penetration, you can use a dermal roller. So after that, you have to push the product to do a strong massage, and like that you can distribute the product under the skin in a better way. So two indications with this product, it's the periorbital area, because usually we have a superficial action, and the lips area and perioral area. Very interesting after injection, even if it was a long time ago, or immediately after injection. So I have treated some patients who had the injection few years before, or sometimes 10 years before. Here you can see the protocol that we propose. So we have on average 3 sessions to use hyaluronidase in a topic, so Topilase. Of course, it depends on the cross-linking of the product who was injected. It depends on the layer who was injected the product, and it depends of the time that you use the product. For example, if the product was injected 10 years ago, you need to do more sessions. So usually we have to do 3 sessions every 7 days. So at the first time you see your patient, you can do an application. After that, after opening the valve, you put the valve on the fridge, in the fridge, and you ask your patient to come back 7 days after. You do the second application if you need. If you don't need, sometimes you don't need, it's okay. But if you need a third application, you ask your patient to come 14 days after D0, and you do the third application of Topilas. You can treat 3 patients with a valve if you want. You can do 3 or 4 session with a valve, and you can of course use one valve for many patients. Of course, you have a brush into the box will help you to be safe with infection and everything. You have to clean the brush and to use it. Now, clinical results that I propose to show you. You see here, I did a study with the Vectra technology, and if you apply the product, you have an immediate result few seconds after applying the product. So we did a study with the quantification of the reduction of volume, and we saw the average of 0.27 cc after applying the product immediately after. Next slide. So here you can see a patient. I choose to show you this patient because it's a very hard indication. This patient has had a lot of product just injected in a wrong way. It was too superficial, and with the aging, the product was very important and always more and more. So the injection was done 7 years before, and I did 3 applications of Topilas, and you see the reduction, of course, of volume under the eye, slowly after the 3 applications, and you see that she refined the firmness of her skin, even if she's 71-year-old. The other case, I show you how I use Topilas. So very easy. You apply the cream in the periorbital region, usually infraorbital, and you see here with the massage, you can press the product. You feel the product going less viscous under your skin, under your finger, and you see you can distribute the product in the depression of the dark circle. So what you can observe is that it can move the product, and you can regularize the product, the distribution of the product in the infraorbital area. Next slide. So here this is with the lips injection. So I used a little bit too much product, but I did it for the Topilas experience. And my patient was very happy at the end of the application of Topilas. At the beginning, she was a little bit worried about the result because she thought it was a little bit too much. And I put immediately after injecting the patient the Topilas, and you can see that the reduction, you can see the reduction of volume between the second picture and the third picture, but she keep a volume very natural. After, you have to do as you want. If you want to put more product, more Topilas, in order to remove the product, you can. But if you want to decrease a little bit, the swelling after injection, you put a drop, very, very small drop of product, and you will have a patient very happy to go at home or to go working without swelling and without seeing injection into the lips. So you see here the reduction of volume few minutes after applying Topilas, and the final result after applying Topilas. Of course, few minutes are enough to have the result. The next slide show you the only one application of Topilas on the lips, and you see that she doesn't come back at the first picture as before injection, but she keep a volume, and it was very natural. Here you see a result of a colleague. You see that the patient had too much injection on the nasolabial fold. It done, like overcorrection, and immediately after applying Topilas on the nasolabial fold with a pressure, you can put a finger into the mouth and create a good massage, and a few minutes after you have a patient very happy to recover the nasolabial fold and the dynamic smile. So the next picture show you that we did an expert study with a lot of KOL all over the world, and all our doctors were very impressed about the result of Topilas and very happy about this new way of injection and take care of injection. It's not an injection, but it's just to have a perfect result. Next slide. So more than, of course, 500 patient was treated in my office, but now a lot all over the world, and everybody was very happy. Now you can see a video with a testimony. So you see.
Sorry, I will share the sound. Sorry.
So it's a patient I have treated. She was coming to see me for the first time after another correction and
risque et rassurant. J'ai été donc injectée à l'acide hyaluronique il y a plus d'1 an au niveau du contour des yeux, car je trouvais mon regard creusé. Je n'ai pas été satisfaite du résultat et la seule solution qui m'ait été proposée à l'époque a été une injection de hyaluronidase. Ce traitement n'était pas adapté à mon cas car je ne souhaitais pas recourir à une procédure invasive. J'avais donc perdu l'espoir de retrouver mon visage. Et un jour, mon médecin esthétique m'a donc proposé une solution cosmétique en participant au protocole de Topilase qui s'applique juste sur la peau. J'ai tout de suite accepté, enthousiaste, mais sans grande conviction. Finalement, les résultats ont été incroyables. J'ai tout de suite retrouvé mon regard. Là, vous ne pouvez pas vraiment le voir, mais la zone n'était pas harmonieuse. Après application du soin, j'ai constaté que ma peau était donc plus lisse et plus souple, et j'ai senti cette sensation d'inconfort que j'avais s'estomper. Après seulement quelques séances, en 2 mois et aucun effet indésirable, j'ai retrouvé un regard que j'aime.
So, you know, you have to know that it's very important for our patient to have a doctor who can create and undo the problem that we can have with injection. And you will see that your patient will trust you more with something that you can be, you know, you can be an artist and you can be a magician, because always my patients are so happy to, you know, to undo what another doctor can destroy in their face. So now let's see a video. No, not the video, but okay. The slide will show you the launch of Topilas. Can you go back? It's now in Europe. So it's available in France, in Belgium, in Luxembourg, in Netherlands, Spain, Italy, of course in Poland, in Greece, in Republic Czech, Romania, and Turkey. And soon other countries will be open, of course. And now, just to conclude, I will say that Topilas is really a non-invasive topical care, as you have seen, very efficient with no side effects. And it's really a milestone for aesthetic medicine. So thank you for your attention. And I would like to hear my colleagues now to speak about Topilas.
Thank you so much, Dr. Sebban. And now, Dr. Ambroziak, it's your turn to speak about Topilas. Thank you so much.
Thank you. Good evening, everyone. Sandrine, thank you for inviting me here for this wonderful webinar. Can we switch on the presentation? Yeah, so I've been using Topilas for some time, and I must tell you that the more I'm using, the more excited I am. And now it has become almost everyday mandatory tool for me. And of course, we all know all the risk of hyaluronic acid. Next slide, please. But we're using, of course, Topilase only for, let's say, cosmetic risk with hyaluronic acid, which is overcorrection, Tyndall effect, nodules, and prolonged or chronic swelling. Next, please. So we're not using this for vascular side effects. We all using hyaluronidase, but the facts that we have to emphasize is that there is no registration in aesthetic medicine, because even hyalase, as I remember, has no indication in this field. And most products allow only for topical use. So all the risks, if they happen, are on the doctor. One thing to discuss is that the tissue activity of hyaluronidase varies from 24 to 48 hours in the tissue. So that may change for some doctors the protocol of use of Topilase. Next, please. We have some risk of hyaluronidase itself, which is not only erythema, itch, edema, urticaria, anaphylactic shock, which is theoretical because I haven't heard of a single case of anaphylactic shock. But what helps us using the topical hyaluronidase is excessive activity of the injectable hyaluronidase, because patients are very worried about the use of injectable hyaluronidase because they probably they are right. They worry about the host that we are producing right after the injection of injectable hyaluronidase. And skin laxity, as you can see on the picture on the right, is probably to the long extension of the skin with the product. Then suddenly we take it back, we take it out, and then the skin gets like an old cloth. Next, please. Next. Yeah. And next, then we start the video because the product seems to go through the skin barrier quite well, thanks to the mixture of the enzymes. But nevertheless, we can improve the bioavailability of the product by different means. The easiest way is just to use the roller. You can be provided by the SoftFil with the different very good quality and sterilized rollers, but you can use as well the fractionate laser, preferably non-ablative, because we don't produce this burnt crust as with ablative lasers, or we can warm the skin to make the bioavailability higher, or as I started to use the thermomechanical device, which connects the warming of the skin with producing small spots, small holes in the skin, letting the topical go through the skin barrier. As you can see, it's a little bit fast forwarded. We always apply a strong massage afterwards. Next, please. And in my opinion, the major target for the topical hyaluronidase is, of course, the lower lid. We all know those patients. Our record keeper has been wearing the eye bags for 8 years, which is 8 years talking from the injection with the hyaluronic acid product stabilized to use of the Topilase. Next, please. So that was the first patient, just one application, and I decided not to present you the best pictures ever, but the pictures of the everyday patient coming for the topical hyaluronidase, because you can see that the result is small. And in majority of my patients, one application is not enough. We repeated it probably once a week. That this one is just one application. You can see the difference. We've been using the roller 0.2 millimeters and the massage. Next, please. That's another patient with 2 applications. You can see the hyaluronic acid deposits, and then they are gone within 2 weeks. Next, please. And we have next patient with 3 applications. It's totally gone. I used also a roller 0.3 and a massage. And next, we have lots of patients and only 7 minutes to present it. Then this patient was injected with hyaluronic acid 5 years before the application of the Topilase. So I decided to use thermomechanical device and the massage. And after 3 weeks, the results is very promising. Next one. And all of these patients were so afraid of injectable hyaluronidase that they said either we keep on wearing this side effect or we using topical, because there was no other solution for them. The malar part, which is much more difficult because the skin is thicker, the patient has thicker skin and oily skin, and one application with Topilase gave us quite nice results. Next, please. That's a patient injected several times with hyaluronic acid into the nose, and she was complaining of the white part of the dorsum of the nose. And I put you the red arrow on the place that we had a nice outcome just after 2 applications. Next, please. That's my assistant. She was injected into the lips probably 3 to 4 years before. And she was so surprised and excited about the effect, just 2 applications. And we shortened the breaks between the application to 48 hours. Since the activity is from 24 to 48 hours, in some cases I think we can perform the applications much more frequently. Next, please. And probably last, that's the patient from another site injected with mesotherapy hyaluronic acid, and she refused to be injected with hyaluronidase. So we gave her 5 applications with the roller 0.3, and almost all the nodules are almost gone. Okay, and the next and the last, probably, I think I am within 7 minutes. So we are giving you, first of all, super safe product. Secondly, super effective, astonishingly super effective product. And I think you have dozens of patients with the indication for this topic. Thank you.
Thank you so much, Dr. Ambroziak. It was very, very interesting. And now, Dr. Chicon, we are listening to your thoughts on Topilas.
Hello, everybody. I'm really nice. It's really nice to stay here, invited by SoftFil, Dr. Sandrine Sebban, Hannah. Thanks the other speakers, and thank you everybody at the other side of the screens. I want to share with you two different cases. You know, the first one is more common, and the second one is a very special case, and I wanted to share with all of you. I think Topilase, I've been using Topilase, I think a year and a half ago, and I'm really happy. I'm really satisfied because of course, my patients are really satisfied as well. And I think it's a marvelous tool we must have, every one of us, in our toolbox, because it allows us to go further, to go further than the usual performance. And it allows us, I think, to be more confident with in our daily practice. Okay. The first case, please, Hannah, if you're so kind. The first slide, please. Thank you. She is Carmen. Carmen came to me because she wanted to to improve, you know, the tear throw. And after the treatment with Redness 2, we had a mistake, okay, and there, as you can see, there is an overcorrection in the picture of the yes, in the picture of the left side. And she called me immediately. Oh, Jesus, doctor, I'm not happy, you know, because I have a small bump, you know, under my eye, and I feel really uncomfortable. And I say, okay, take it easy, okay, but you have to inject me again. And I say, no, take it easy, because I'm going to send you a cream, a simple cream, you know, but that cream is fantastic, you know. I asked the patient to apply the cream, to be honest, not only once per week. It was twice per week, okay? Twice per week. And after 3 weeks, you know, the final result you can see in the picture of the right side. I think it's amazing, the result. She is completely satisfied, you know, and she told me, oh, Jesus, doctor, it's awesome, you know, with only a simple cream, you know, it's a magic cream, no? She told me that it's really fantastic. This case is very common. I think there are two particular places, you know, two particular areas in the face that the feature of these areas are special indicated the Topilase, and these areas are the periorbital area and the lips, you know, because the mucosa and the skin is really thin, and the hyaluronic acid is really accessible for the Topilase, because it's a marvelous formula, perfectly balanced between the oils and the hyaluronidase, and the oils are the vehicle to penetrate the hyaluronidase, and the result is so amazing, as you are seeing. Okay, the second case is it's very exciting for me, because it was a challenge for me. She is Patricia. Patricia is a high-level competitor in Taekwondo. It's a high-level competitor, and he suffered, you know, she suffered a strike, a very strong strike, you know, in her cheek, and and she had a lack of volume. Okay, she had like a internal scar, you know. And then it was a challenge for me, and with cannula, I tried to break. I tried to break all the fibers, you know, all the fibrosis, and after that, I inject hyaluronic acid to increase the volume there, you know, and to release that lack of volume. Okay. After that, there was an overcorrection, a small overcorrection in this case, and I recommend her that she had to use the Topilase, and of course she was completely satisfied. I need to, you know, this is why I told you that Topilase is a marvelous tool to go further, you know, because in this way, if you know, and if you feel confident that you have a marvelous resource in your toolbox, you know, it's possible for you to encourage you, you know, the Topilase may encourage you to go further and to treat, you know, cases that are a little bit difficult, you know. And for me, it's a marvelous resource. I use it very common, and I'm really happy. That's my experience. Okay, but thank you very much.
Thank you so much, Dr. Chicon. We are now going to hear Dr. Paola Molinari. Dr. Molinari, are you here?
Yes, I am here, and thank you, Anna, for this. I introduce myself. My name is Paola Molinari. I'm a general surgeon, and I have a clinic in Modena, in Italy. And with this presentation, I want to show you my cases. But before of this, can you go on? Before of this, I want to explain to you a pilot study that I did in my forearm. So the goal of this pilot study is to demonstrate how it goes Topilase, because I try to use hyaluronidases and to make a control with other places. What I did was to perform 4 subcutaneous injections with a cross-linked HA, Teosial RHA2 in a forearm. The boluses have been treated in the following ways. Bolus A, no treatment, it's my negative control. Bolus B, hyaluronidases injection. Bolus C, Topilase application plus microneedling plus Topilase. Bolus D, Topilase application. Go on, please. Next one. After 24 hours, you can see in details the image with Vectra for the evaluation of the redness. This image is important because it shows you how hyaluronidase, compared to the sites where Topilase has been applied, has a side effect, redness and burning. Next one. This instead is the result after 7 days from the treatment. And we can notice how the application of topical hyaluronidase is as much effective as the injection with hyaluronidase in removing the accumulation of hyaluronic acid. So then let's start analyzing the different case reports. Next one. These are 3 patients who came to my clinic asking to eliminate the accumulation of HA. Why I'm presenting these 3 cases? Because each one of them had a different request as a consequence of the HA injection in different area of the face. Next one. In particular, next one. No, it's not gone. Anna?
It's not this slide?
No, it was the before this one.
Oh, sorry. Is it this?
Go back. Go back, please. Okay. The first patient complained an excess of HA in the zygomatic area and the perception of the implant and the malar edema. Next one, Anna. Next. The second patient in the middle complained an accumulation of HA in the upper lip. That's the same. And the third one instead noticed the so-called Tyndall effect at the eyelid level as a consequence of the treatment of the tear trap. Let's go. Case report 1. In June, this young patient, she's 30, came to my office and having a heaviness in the eyes and malar edema due to a voluminizing treatment of the malar area. The patient wanted to eliminate this eyelid discomfort, the implant perception. In addition, the patient had referred me that the right side of her face, as you can observe in the slide, was the one that bothered her the most. Since I had Topilas at my disposal, it was just arrived in my clinic. Before evaluation to use the hyaluronidases, I tried with it. Next. And this is what I made. The right side has been treated with Topilase and in addition also microneedling using a 31 gauge 1.5 millimeters Paskin needle. The left side, on the contrary, only with Topilase. Once the treatment has been carried out, a protective film has been applied to promote the absorption of the product. I think it was better for this to improve it. Next one. And the same treatment was performed for those 2 sessions, 6 days apart. Next one. And in details, this was my protocol. Next one. Next one, Anna. Applied on both sides 4 drops of Topilase and distributed the product with a brush. Sorry, Anna, you have to turn back.
Okay.
Okay. And distributed with a brush, and then I made a message. In the second, you can observe the treatment on the right side with the microneedling. In the third one, I applied again Topilase. In the fourth one, I made an occlusion with film to promote absorption, only in the second session. Next one. And here you can notice the picture of the patient before the treatment with Topilase and after 48 hours on your right side. The patient referred me that already after 24 hours, she could start observing the difference. And after 48 from the treatment with Topilase, the right side was less swollen. Then, next. In the slide, we can see the image made with Vectra camera, and you can observe a relevant reduction of the swelling between this before and after treatment 6 days with Topilase. Next one. And here I compare the before and after in static picture, and next one in dynamic. And you can notice the accumulation of hyaluronic acid present in the patient before the treatment with Topilase, circled in white, how these are no more visible in the second one after 2 sessions, 8 days later. Then the second case report. It is with a woman who is 50 years old. She complained an accumulation of hyaluronic acid in the upper lip, and I proposed her treatment with Topilase and a further treatment with dynamic acid filler to give some volume to give her more definition to the lips. Then the assay accumulated formed a sort of string at the level of the vermilion border. I drew the area to be treated and apply 3 drops of Topilase, messaging for a few minutes, apply the film again to facilitate the absorption of the product. Next one. And here you can observe how it is resolved the problem, and the patient was really satisfied with the result. Then the last one, the last case. Then Anna.
Yeah. I switched this is case report.
Okay, let me present you the last case. It deals with a patient who is 50 years old again, who had underwent a treatment to the tear trap and under eyes hollows. Nevertheless, the patient complained of Tyndall effect due to the migration and to an excess of injected product, as you can see in the picture. The next one. I used the same protocol as in the first case with Topilase, microneedling and Topilase again. And next. In the picture, you can see the result I obtained with only 1 session of treatment with Topilase 30 days apart. The accumulation of HA has been eliminated, and also the Tyndall effect with only 1 application, 1 session. So last one. In conclusion, treatment only with Topilase give for me good result, especially for the reduction of immediate edema. Treatment with Topilase and microneedling good results in promoting the reabsorption of the filler, especially in the reduction of attenuation, irregularities, swelling, asymmetries. Topilase reduces some of the common side effects of hyaluronidases, such as redness and burning. Hyaluronidase remain for me the treatment of choice in major ischemic complications. I think it's easy to apply, no harm on the part of patients, very important. The skin in the area treated with Topilase appears more smoothed, and visible results already after 24 hours since application. Thank you very much.
Thank you so much, Dr. Molinari. I will now give back the speech to Dr. Sebban, and we will answer your questions.
Okay, thank you very much. It's very interesting and to share our experience with Topilas. I think, you know, something very interesting is that we have to know that from the moment when the doctor do the diagnosis of overcorrection with HA, we can let the product on an assistant and she can apply the cream if she wants, if this is, you know, an assistant trained, of course. I think that it's very reassuring to have a cosmetic instead of injection for your patient, and very reassuring too for the doctor and for the patient to have, you know, something very effective to perfect our result. And of course, as you have heard, the combination of different techniques using a skin roller, you know, radio frequency with needles, microneedling, LED lamp, etc., can help the product to go inside in order to be, of course, more effective when we have deep problems. Of course, it's not like hyaluronidase injectable, or you don't have to expect to treat, you know, an occlusion, a vascular occlusion with this. But some doctors and very known, you know, surgeon told me when they have tried it that it can be, you know, a solution just during the time you go to find your vial of hyaluronidase injectable. So if you have a vascular occlusion and if you have Topilas in your office, you can use it just immediately in order to prepare everything.
Vale, sentaros, pasar, sentaros.
Jesus, we can hear you. So no problem. And you know, my goal with SoftFil is to be safe, to have the most safe injection with cannulas, and of course with Topilase. So I think now we have another tool in order to be really reassuring for our patient and for us. So now I propose my Anna to have a question and answer.
Yes, we don't have a lot of time for questions, but please don't hesitate to ask any questions in the Q&A or in the chat. We do have already a few questions. Some were already answered, but so if you inject into the artery by mistake while you are practicing lip filler, can you use this product?
So I was telling you that for my part, I think no, it's not the treatment of vascular occlusion, of course, but it can be a solution just in order to have time to do something, you know, if we have an emergency, all techniques that we can use to reduce this vascular occlusion can be the welcome. So what do you think, Paola and Marcin and Jesus, for this?
I think we have to emphasize that it is, just to make it clear, it is not a tool for vascular obstruction. But when you have it already and you already injected this with a hyaluronidase, injectable of course, and you wait until this marble effect skin is off, then additionally you can use Topilase to make it better, more effective, because then you know a doctor and the patient are in panic. So we do everything, anything to make it disappear faster.
I think it's right just for the redness and for the moment, but I don't think it's the right treatment in case of ischemic accident.
I completely agree with Dr. Ambroziak. The vascular occlusion is an emergency. It's a situation of an emergency, but it's a perfect resource of second fight. You know, we can use after the hyaluronidase injected.
All right, thank you. I have a question about Topilas attacking your own hyaluronic acid. Can you please talk a little bit about this?
Probably Paola, if you want to explain.
Yes, I tried it with a RHA2 and not with other hyaluronic acid. I think perhaps it will work, but I don't am able to understand how and how much it is possible with Topilase. I thought about this and I want to try again with another one, another forearm perhaps, and try again for this thing.
And with my experience, I saw so much patients who have refined the firmness of the skin after using Topilas and better than before. I think that, of course, we have created our own HA all days, every day. So, of course, it's a cosmetic and it's not possible to, destroy this HA forever. So what is interesting, it's, when we degrade something in our body, we create, in contrary, more, production of HA. So I think that it could be another way of R&D to understand the possibilities of hyaluronidase to enhance the quality of the skin.
Thank you. After application, does Topilas have to be completely removed before the patient goes home?
Marcin?
I let it dries in seconds after application, and I tell patients just to go home with the Topilase on their skin, and when they do the washing in the evening time before going to bed, then they wash off the Topilase. Let it work for a few hours.
So for my part, for allergic patients, I am a little bit more, I am careful, and I remove the product in order to avoid allergy after we don't know what the patient can do. But of course, Marcin, I agree with you.
Yeah, but we can expect only local allergy, if any. Remember, I was searching through PubMed. I couldn't find any anaphylactic shock after injection with hyaluronidase. I don't know if you know such cases, but I think it's we overreact with the anaphylactic shock and the allergy.
Yes.
In general.
Of course.
All right, thank you. We have a question for Dr. Molinari. Did you see any redness or swelling after microneedling and Topilas?
No, I didn't see it. And the only problem I have for this is to combine a cosmetic with a surgical use, like microneedling is. The only problem is medical legal, not other. I don't think you have any problem of swelling, of redness, and so on.
From the same doctor, do you think Topilas will work on a very established Tyndall effect?
Yes, I think so. And my patient was a case of this, because her Tyndall effect was derived from a treatment made on 1919. So it was quite old.
Yes, I think, you know, Tyndall effect, it can be very efficient, but it depends on the product who was injected. If it was, for example, Voluma or Stillage XXL on this area and superficially, of course, it will be impossible to remove the product with a Topilase. I think it's more easy to remove this product if it was a low cross-linked HA, like, you know, Stillage S or Redensity 2 or I don't know, Volbella or something like that. So I think it's important for this. And if it's a deep injection, of course, you will need a lot of session in order to remove the product.
Thank you. An interesting question. How many weeks do you wait for injecting HA in the area treated with Topilas?
Very good question. For my part, I wait 15 days. I don't know for with my colleagues. What do you do?
The same.
In most patients, we don't have to re-inject because we are removing just the excessive product. In 90% of my patients were coming to our office with their eye bags. So, and they were afraid that we will remove all of the product and they will stay with those hollows again. So we're trying to use as many sessions as to give them good result.
Thank you so much. Maybe a last question. After you open it, can it be used for one or more patients?
After opening it, you can use it for a lot of patients. Usually it depends, you know, the quantity that you will apply depends of the area, the surface of the area that you want to treat. If it's only, you know, a small area like infraorbital region, like Jesus showed us, overcorrection in very, very specific region, you need 1 drop, 2 drops, I don't know, 2 pressure. But if you have to treat the whole face, I had a case like that with overfilled syndrome, and I need a vial for 1 application. So it depends of, you know, the surface of the face that you want to treat.
All right, thank you so much. We are a little bit late, so I think we will end the webinar, but thank you so much to everyone for attending. Thank you to our amazing speakers. Again, you can see the replay of the webinar from tomorrow on SoftFil Academy's website. One last warning, of course, Topilas is only sold to doctors. SoftFil basically only sells all of its products to doctors. So this was just to conclude. Thank you again and have a great evening.
Thank you.
Thank you. Thank you to everybody. Bye-bye. Thank you, Sandrine, for your invitation.
Thank you very much. Thanks to you.
Bye.
Bye.
Bye.